Hello everyone, Marty Walsh here, and I'm grateful to help kick off the very important symposium, Working Recovery. Thank you all for the work that you do in our communities. And as you know, the issue of recovery is very personal to me. I am in recovery myself. I grew up in Dorchester, the son of Irish immigrants. When I got cancer as a kid, our community helped my family get through it. When I struggled with alcoholism as a young adult, it was our community that helped me get the help I needed, the labor community and the recovery community. Getting into treatment saved my life and allowed me to get back to the workforce, into a job that offered dignity and opportunity. I was grateful and I was determined to pay it forward and fight for other people who needed a second chance. That's why I dedicated myself to public service, first as a state representative from Dorchester, then as mayor of the city of Boston, and now as the United States Secretary of Labor. Over the years, I've worked closely with some outstanding local organizations, including the Gavin Foundation and many others represented at today's event. We've made tons of progress in Boston and throughout the Commonwealth of Massachusetts. We've increased the services that are available. We've reduced the stigma around substance use disorder and made it easier for people to get the help they need. We focused on closing racial disparities in access to care, and we've diverted more people into treatment instead of jail. But as you know, there's still so much more work to be done. It's never been more important for us to come together as Americans and help people who are struggling. The pandemic has been hard on everyone, but it's been especially difficult for people struggling with substance use disorder. Many people in recovery rely on routines and relationships to keep themselves anchored. COVID turned everything upside down. A lot of people have been battling fear, loneliness, and uncertainty on a daily basis. There's been an increase in overdoses, relapses, and mental health crises. It is a ripple effect on entire families and entire cities and towns. That's why supporting people with substance use disorder is not only the right thing to do, it's also essential to our country's long-term recovery from COVID. We must provide people with the tools they need to get back into the workforce and sustain their recovery in the long term. That means access to affordable housing, access to education, and especially access to good jobs and job training. We know that having a stable job goes a long way in sustaining recovery and rebuilding your life. But oftentimes, a criminal record and long gaps in work history create a cycle of unemployment. We need to break that cycle by creating more recovery-ready workplaces. This is one of the Biden administration's top drug policy priorities for year one. The President's Build Back Better plan would provide historic funding for job training programs focused on people facing major barriers to employment. We need to jumpstart more collaboration between employers, community colleges, and nonprofits to build on-ramps to employment. We need to create job training programs and prepare people for the careers of the future. And we need to keep strengthening our enforcement of the parity laws for coverage of mental health and substance use treatment. It's also time for our healthcare systems to focus more on social determinants of health so that people can return to their communities and find supportive environments for their recovery. And finally, we need to keep fighting the stigma around getting help for substance use disorder because people's lives depend on it. I'm speaking out about my own recovery experience as a member of the President's Cabinet, and I'm grateful to be implementing this work at the Department of Labor. The bottom line is that getting most vulnerable people back to work is essential for our local and national recovery efforts. The Massachusetts Access to Recovery program is pioneering some bold ways to prepare people in recovery for today's labor market. You'll hear more about these models throughout today's symposium. I look forward to discussing them and talking about how we can adopt them in our workforce. We have a long road ahead, but I'm hopeful that we're entering a new era of American excellence, one defined by compassion, empathy, and hope. Together, we're building a stronger nation where everyone can achieve their dreams no matter where they come from or what they've been through. Thank you once again to everyone who's participating in today's event. You're making a real difference in people's lives.